one, you said that in case you find out that your colleague is involved in some relationship, and you have to report that. In case we answer that we confront our colleague and ask them like you're not allowed to do this and etc etc, and then in case they don't stop, then we escalate the matter to the higher authorities. Would that be a right answer?
In a relationship, no. In a relationship answer, you will not confront, you will not talk to them yourself. If you see something, you just report to the ethics committee or however is set up for that institution. That has been my understanding, and that has its reasons. I think what I discussed, the reason was that if for some reason, the person is your friend,
Hmm.
you would, in a way, if you approach like this, that you would talk to your friend about it, you will be very reluctant to complain about your friend. So remove
Okay.
this emotionality from the beginning. Remove these mind games from the beginning. If you see something, you just have to let the ethics committee know, or the whatever procedure that they have for the hospital.
Okay. And the second one, you said in case the patient comes to your clinic and they want to get involved in a relationship, can we say to the patient, like, give them some time to arrange another doctor or physician and like stop the doctor patient relationship if we feel that patient is not taking a no?
Yes. So if the patient not taking a no, you
Yes.
cannot abandon the patient. You
Mm-hmm.
need to
Yes,
have
yes.
you have to have somebody else. Definitely, you're right. You will always have a chaperone, and you would, of course, nobody after the patient realizes that okay, the doctor is all business, and there's a chaperone, then nothing significant will happen, of course. Um, um, and then you would proceed with finding the patient another physician. Once you have
Yes.
found a
Okay.
patient, found a physician,
Mhm.
and communicated about the patient, then you're all good. So it
Okay.
happens
Okay. Got
is that it happens a lot in clinic. It also happened, and this could be another question. The patient is in clinic, abusive to you, arguing, calling you names, whatever, whatever. You cannot say, I refuse to see the patient. You cannot do that. You cannot say, I refuse to see the patient. I don't care. Whatever happened, patient dies. I don't care. You cannot do that.
it. Yes. Yes, of course.
And you have to find another accepting physician. Then you can
Mm.
let go of the patient.
Okay. Okay. Got
All
it.
right. Good question. Anybody else? Any this?
I had a question, Dr.
Yeah.
Omar.
Uh-huh.
So, what if they ask you, how will you verify that the relationship is actually true and it's not just your suspicion?
So, so this situation only happens if it is very obvious. Okay.
Okay.
And there are certain environments, right? The hospital environment is one. It
All
would be
right.
very obvious, and they would not be able to hide the relationship. In clinic is different. If you are working in a group clinic, is different. But many of these episodes or issue these things in real life don't happen too much. To be honest, they don't happen too much. But if they do happen, people only find out when it is beyond a certain limit, that
Okay,
you
got
notice,
it.
okay, this, right? It's not going to be very
Understood.
obvious unless it has gone a couple of steps. They are now really in a relationship, right? They're
Okay.
emotionally involved, all of them, both of them. Um, then you will only find out. Usually you won't find this out because yeah, it will be a rare occurrence that you will find this out. However, um, if it does happen, you will see it. Oh yeah, okay, this is strange, because you're human, right? You can see what's happening. Okay, they are,
Mm-hmm.
being too cumbly, whatever. Or you're seeing them outside, or you saw them somehow at a restaurant together. But again, you won't know about it unless he or she tells it to you, or indirectly somebody else mentions it, because so for this to happen, there are many things need to happen. You need to know that patient is his patient as well, his or her patient. There's
Okay.
very little chance that you will know about it unless you are all are sharing patients, or that is your patient as well as his patient or her patient, that you are the gastroenterologist and he is seeing the other doctor who is a pulmonologist, and he says something that, hey, I'm dating him or something, right? So this situation will be obvious to you in a way. So yeah, different situations, but whenever this happens, this will be very obvious. Okay.
Okay, thank you.
All right. So
Tajama, what if you I'm sorry to cut you off. What if you find someone outside the hospital, and it's outside the hospital premises, and you see someone and you clearly know that they're hanging out with one of their patients in a romantic setting? Would that still be your responsibility?
Yeah.
Could you pretend that you never saw them?
Well, make sure they never saw you, that they never know that you know about it.
Yeah, okay. Just to avoid the whole hassle.
Just don't look at this. They don't need. So, for example, again, everybody breaks up, right? Especially a lot of people break up, right? So they know this is illegal. Both of them know this is illegal usually, and the person, the patient may complain if they're really upset at the doctor that, hey, he or she was dating me, right? And oh, Abdullah also knew about it. So just yeah, if you don't know, don't know. That's good.
Perfect.
Omer?
Yeah, Dr. Khan, I have just one question pertaining to the same scenario. If a patient shows a relationship interest in a physician and the physician engages in direct communication with them to counsel them against it, what's the right way to do it? I mean, should they say phrases like it's professionally unethical or inappropriate? What's the right way to counsel them?
That's it.
That's it.
Inappropriate and unethical.
All right.
You are my patient, but you have these feelings. It is probably not proper that we maintain our doctor-patient relationship. I would love to connect you with a colleague of mine or somebody else that you may want to pursue your care further with. And we can work on a transition of care.
Right, sir.
But all of these conversations, you need to call a chaperone immediately.
Understood.
Okay.
Thank you, sir.
All right. Anybody else? Important question.
Hello.
Yes, yes.
Hi, Dr. Umar. I just wanted to ask, like, if somebody asks you that, how would you know that you have satisfied the needs of a patient? How would you know that you're fulfilling the needs of a patient? How do you answer that?
Okay, that's great. So after every visit, this is what you're supposed to do. Have I addressed your concerns?
Okay.
That's it. Is there anything else I can help you with?
Mm-hmm.
Have I addressed your concerns? Is there anything else I can help you with? That's routine. That's supposed to be routine with any visit.
Mm-hmm.
That's any visit. Any visit. Anybody else? Any other questions you're getting? Any other issues?
Hello, Dr. Umar. One of my friends got the question that what if you suspect that the doctor has a relationship with the medical staff, like nursing staff, what will you do? So he was like blank out and they said,
No, okay. So a lot, you would say that relationship in the workplace, I would frown upon this. And a lot of hospitals have policies. You would say that definitely there's an employee handbook, and we will follow the policies. We will follow the policies as delineated by our employee handbook regarding relationships among colleagues, and we will look to strictly follow that. Some hospitals, people will get into relationships, and that's okay if it's not your patient, if it's not affecting your superior or subordinate situation, then it's reasonable. But if it affected a situation that you are providing unnecessary favors, or they're getting unnecessary favors, being able to come in late, getting that extra vacation, that cannot be happening. However, I will of course look at if there's a situation such as this, I will review the policy of the hospital and the establishment and see what is the protocol. However, I do frown upon a relationship within the hospital. Although, if I see there is a relationship happening, but that relationship is leading to unnecessary favors, then that I believe would be unfair to the whole hospital system and other colleagues. I would definitely bring that up to notice to the ethical committee.
Yeah, thank you, sir, doctor.
So because
So,
people
Dr.
will have,
Yeah,
you do find your spouses or people in the hospital, that's fine, but it should not affect the workflow at all.
okay.
It should not
Thank you,
affect
doctor.
the workflow at all.
So, Dr. Umar, if if they ask you if you found your colleagues, your other resident in a relationship, so this is gonna be the same answer?
Yeah.
Like other resident and you find your senior resident and your colleague is in a relationship. So the answer is I will look into the hospital policies if they getting the unusual favors to each other
Yeah.
or it's affecting the team.
Exactly. Your issue is only unusual favors.
Okay.
They're consenting adults, perfectly fine. Okay. But your issue is if the guy is a third-year resident and the woman is a first-year intern and she's getting the best shifts and everything else, that's the problem. If they are doing the job properly, there's no problem.
Thank you.
Okay. Okay, so these questions are coming up a lot, huh? These questions are coming up.
Yes, this season they are asking ethical questions rather than the robotic ones.
Right.
And the medical knowledge related to medical knowledge too.
They're asking medical. So everybody has prepared a case, right? Everybody has at least a case.
Yeah.
Right.
I think so.
So basically, those medical knowledge questions are about being able to present a patient. That's to my understanding, be able to present a patient. And most of us, whenever we come from different countries, we have done some work, house officer or medical officer or whatever. Some people more advanced. So there's looking at if you're able to present a case.
Yeah, now they are asking you to present any case, like not the interesting case. Last year it was like everyone was asking everyone that tell me about any interesting case. Now they are asking present any case, like in a shop, like you are in rounds.
Present any case.
Yeah.
Okay,
Present
exactly. Present. They want to know if you can, because you will, when you are a resident, right, intern, you are expected to be able to present a case. There's no like easing in.
Yeah, that's why they like last year. One of my senior told me most of they got the resident who were not able to like present the case even in the rounds. So now these programs are looking at those candidates who can at least present the case, even a simple case. So that's the main reason behind it.
Right. You know why I'm thinking they're noticing? Because back in the day we had the CS examination, right? So we would we were not presenting a case, but we were going through the US way of asking questions and history and getting all the input from the patient. And we were at least writing notes, right? In the CS exam, the clinical skills exam. And that's, I think people back in the day before COVID were a bit more prepared from the US standpoint. So I think they may have noticed this in the last couple of years that people have not been ready like that. So that's why I've always emphasized be able to present a case, past medical history, review system, pertinent vitals, pertinent physical exam findings, important laboratory results, and assessment and plan. Right. So just have to go through the whole process. Okay. Anybody wants to take a jab at answering a question?
Yeah, I can go ahead, Dr. Umar.
Okay. Let me come up.